The European Medicines Agency is broadening its investigation into a class of popular weight loss and diabetes drugs. The probe began earlier this month when patients in Iceland reported thoughts of self-harm and suicide after taking Ozempic and Saxenda. Dr. Celine Gounder is joining us now. She's the editor-at-large for public health at Kaiser Health News, a physician and epidemiologist at NYU and Bellevue Hospital, and a CBS News medical contributor. So, Dr. Gounder, what is the EMA really looking to do? What are they looking to investigate and determine?
Well, there have been reports of suicidal thoughts or suicide among people taking these medications. But I think it's helpful to back up a little bit and understand how we review these things. We have a similar system here with the FDA for drugs as well as vaccines. People may be familiar with VAERS, which is the vaccine system. There's something called FAERS with an F, similar system for drugs, where anytime somebody has a side effect, it may be related to the drug or vaccine or not, but it needs to be investigated. You can't say if there was a relationship until it's been investigated, and that's precisely what's also happening in Europe right now.
See, I thought maybe this might be connected to one of the things that these drugs can do, which is kind of like limit your cravings. I mean, how do these drugs work, and could there be a connection with your mood in general?
Well, they work by regulating the hormones that talk between your brain and your gut. It's sort of how you have communication between the brain and the gut. So one possibility is that these drugs are indeed causing these mental health issues where people have suicidal thoughts. This could also just be happening at random. You know, some proportion of people who are obese taking these medications may also have mental health issues. And then there might be another way in which these are related, where somebody has mental health issues, they overeat as a result, and they have mental health issues, and then they have suicidal thoughts.
Right.
So you can't say without looking into it further.
Right. So I know that, okay, so in the U.S., the prescribing information for Saxenda suggests monitoring patients for depression. It's right on there. And as I understand it, during the testing phase, these drug companies did notice this, and it's on U.S. labeling. Why is it not on the labeling in Europe?
Well, that I can't speak for the EMA, but that said, these are things that we have seen. We don't know if there is a cause and effect relationship here, or again, if it's one of those other possibilities, right? And so just because you have a report of this does not mean that the drugs are causing it, but we need to study this more.
So if at the end of the investigation there are problems, what does it mean for this class of drugs?
Well, then you're probably going to see some warnings on use of the drugs. Even now, I would suggest that if a physician or other healthcare provider is prescribing these medications, they should be monitoring their patients for mental health issues, just in case, right? Because we still don't know. Patients who are taking these medications should be aware that this is maybe a side effect, and so they should be monitoring themselves as well and just aware that this could be an issue.
So I don't know if you know this, but when this popped up, if people stopped taking the drug, did these feelings and these thoughts also go?
We don't know if that has been the case across the board, but yes, that would be one of the signs. If you're on the medication, you have these feelings, you stop the medication, they go away. That would be, it's not proof, but it would sort of sway you in that direction that maybe there is a relationship.
Right. It's interesting. I mean, a lot of people are interested in these drugs. Dr. Celine Gounder, thank you very much.